You've been sold the same exercise story for years. Doctors say it, magazines repeat it, family members mean well and echo it. Walk more, hit your steps, aim for 10,000 a day. But a 2023 University of Missouri study delivered a jolt the health world didn't expect. In adults over 60, researchers found that targeted chair-based exercises boosted functional strength by 27% more than walking alone. That's not a tiny edge. That's the difference between standing up with confidence, lifting a grandchild, and feeling stuck in your own body. And here's the uncomfortable part. An entire industry thrives on keeping the spotlight on walking. Shoes trackers, treadmills, step goals. Walking is great for your heart, no question. But for decades, orthopedic specialists have quietly agreed on something most people never hear. Walking barely touches the muscle loss that accelerates after 60. That muscle loss has a name: sarcopenia. It can drain about 3 to 5% of your muscle each decade after 30. By 70, many people are dealing with as much as a 30% drop in strength. Walking won't reverse that. But 5 simple chair exercises can help fight back. A 2022 Harvard Medical School study tracked more than 2,000 older adults for 18 months. Those who did seated resistance style movements increased muscle mass. The group that stuck to walking lost muscle instead, despite similar ages and health profiles. Even more surprising, the top exercise on today's list, the one we'll reveal last, raised bone density by 19% in people over 65. Surgeons are now recommending that exact movement for hip replacement recovery because it's outperforming traditional physical therapy approaches. Before we jump in, tell us your age and where you're watching from. We read and respond to every comment. Now, let's begin with number 5. And yes, this first one catches most people off guard. Number 5, seated calf raises. We're starting with an exercise most people overlook, and that mistake can quietly steal your independence. Seated calf raises look almost too easy. Sit down, lift your heels, lower them back. But this simple motion trains one of the most important muscle systems in your lower body. Your calf muscles, the gastrocnemius and soleus power, what's often called the venous pump. Each time these muscles tighten, they help compress the veins in your lower legs and drive blood upward toward the heart. That matters because blood from your feet has to move against gravity. When calves are weak, blood tends to collect in the lower legs, increasing swelling varicose veins and raising the risk of serious clots. In 2021, the Journal of Applied Physiology reported on 140 older adults with mild circulation issues. One group performed seated calf raises 3 times a week, while the other group made no changes. After 12 weeks, the exercise group improved venous return efficiency by 41%. Ankles were less puffy, legs felt lighter, and key risk markers linked to deep vein thrombosis dropped noticeably. Walking uses the calves, yes, but it spreads the effort across many muscles. Calf raises focus the work where you need it most. Here's how to do it right. Sit on a sturdy chair with feet flat, knees near a 90-degree bend. Press through the balls of your feet and lift your heels as high as you can. Hold at the top for 2 full seconds, feeling the squeeze in the back of your lower legs. Then lower slowly to the floor. That controlled lowering is crucial because it creates an eccentric contraction, which helps build strength more effectively than lifting alone. If you're new, start with 15 reps, gradually progress to 3 sets of 25. When that feels easy, add resistance by placing a heavy book or small weight across your thighs. Surgeons favor this move because it's joint-friendly, especially for people with hip or knee issues, since the load stays in the ankles and calves. Do this daily, ideally once in the morning and once in the evening. And many people notice their legs feel better in as little as 2 weeks. Next, we'll shift to an exercise that tackles a completely different weakness. And if this video is helping you tap, like so more seniors can find it and subscribe for new senior health tips every day. Number 4, seated knee extensions. This move strengthens the muscle that decides whether you can climb stairs, rise from a toilet step out of a car, or stand up without help. That muscle is your quadriceps, the large muscles at the front of your thighs. They power everyday movements and they fade faster than most muscle groups as we age. A 2020 University of Vermont study reported that adults over 60 lose quad strength at nearly twice the rate of the younger adults. Researchers followed 400 people for 5 years and saw a clear split. Those who skipped targeted leg training lost about 16% of thigh muscle mass. The group that did seated knee extensions 3 times a week gained 4%. One simple habit created a 20% difference in results. Here's why walking doesn't save your quads. On flat ground, the quadriceps barely fire. They help a little as your leg swings forward, but they aren't challenged by real resistance. Muscles grow only when you give them a reason. If your quads never work hard, they shrink. Knee extensions fix that by making your quadriceps lift your lower leg against gravity, sending the build strength signal your body needs. To do it, sit tall with your back firmly against the chair. Hold the seat edges for stability. Straighten one leg until the knee is fully extended, toes pointing up. Squeeze the front of your thigh hard and hold for 3 seconds. You should feel a strong burn in the thigh. Lower the foot back down slowly over 4 seconds. Switch legs and repeat. Do 12 reps per side, rest 30 seconds, then complete 2 more sets. The biggest payoff comes from the squeeze at the top. Don't lift and relax. Contract the quadriceps intentionally as if you're trying to make the muscle stand out. That mind-muscle focus matters. A 2023 paper in the European Journal of Applied Physiology found people who consciously squeezed during exercises gained 31% more strength than those who simply moved through the reps. When body weight becomes easy add loads with ankle weights or a resistance band around your ankles. Begin with 2 pounds and increase gradually. Orthopedic surgeons often recommend this for everyone over 60 because stronger quadriceps help slow arthritic wear by acting like a shock absorber, reducing stress on the knee with every step. Next up is an exercise that surprises most people because it trains a muscle you probably forgot you even had. Number 3. Seated hip marches. Your hip flexors are the quiet drivers behind a safe, confident stride. These muscles, mainly the iliopsoas and rectus femoris, lift your thigh toward your chest every time you take a step. When they weaken, your walking pattern changes. Steps turn into shuffles. Your toes don't clear the floor, and suddenly you're tripping over nothing. A 2022 Mayo Clinic study that analyzed the gait of 800 adults ages 60 to 85 found hip flexor weakness was the strongest predictor of future falls. Those with the weakest hip flexors were 4 times more likely to fall within the next year. For older adults, a fall isn't just an inconvenience, it can change everything. The Centers for Disease Control reports that 1 in 4 adults over 65 falls each year, and about 20% of those falls cause serious injuries, such as fractures or head trauma. Hip fractures are especially dangerous, often setting off a rapid decline. About 30% of seniors who suffer a hip fracture die within 1 year. This isn't to scare you. It's to push you to protect yourself. Seated hip marches build the exact muscles that help prevent falls. The movement looks like walking, but it trains the hip flexors with more control and a stronger lift than a normal stroll ever requires. To do it, sit on the front half of a chair without leaning back. Keep your spine tall and your core lightly braced. Lift your right knee up toward your chest, as high as comfortable, letting the foot leave the floor. Pause for 2 seconds and feel the work at the front of your hip. Lower slowly, then repeat on the left side. That's 1 rep. Move slowly and avoid swinging your leg with momentum. Lift using pure muscle. Aim for 20 total lifts alternating legs and complete 3 sets with 1 minute of rest between sets. To make it harder, hold the top position for 5 seconds instead of 2, or add ankle weights once the basic version feels easy. Surgeons have noticed that patients who practice hip marches daily before joint replacement often recover faster afterward because their muscles are already stronger and ready for rehab. You'll also sharpen balance since your core must stabilize your body while one leg is raised. Now, we're moving into the exercises orthopedic surgeons consider essential for staying independent. Number 2, seated rows with resistance band. So much of daily life is built on pulling strength, opening a door, sitting up in bed, tugging on a shirt, lifting grocery bags, even wrapping your arms around someone you love. All of that depends on your back muscles, especially the latissimus dorsi, rhomboids, and rear deltoids, the muscles that help you stay upright instead of folding forward with age. When these muscles fade, gravity takes over. Shoulders roll inward, the upper back rounds into kyphosis, and it becomes more than a posture issue. A hunched spine can crowd the lungs and make breathing feel harder. It shifts your balance forward, raising fall risk. And as the head drifts in front of the body, neck, and shoulder, pain often becomes a constant companion. Walking won't fix this. Your arms swing along for the ride, but there's no true pulling work. That's why plenty of devoted walkers still end up with poor posture. They've ignored the entire backside of the body. In a 2021 American Journal of Physical Medicine and Rehabilitation study of 300 older adults over 6 months, the group that trained seated band rows improved spinal posture by an average of 8 degrees, while the walking-only group didn't change. The rowing group also reported 63% less upper back and neck pain. To do seated rows, grab a resistance band. It's inexpensive, joint-friendly, and strong enough to build real muscle. Sit tall with feet flat and about hip-width apart. Loop the band around the soles of your feet and hold an end in each hand. Start with arms extended forward and light tension in the band. Now, pull your elbows back, bringing your hands toward your ribs, while squeezing your shoulder blades together, as if you're pinching a pencil between them. Hold the squeeze for 2 seconds and focus on the muscles between your shoulder blades. Then return slowly, extending the arms forward under control. Don't let the band snap back. Do 15 reps per set for 3 sets. Choose a band that lets you finish all 15, but makes the last 3 feel tough. If it's too easy, move to a thicker band or double the one you have to increase tension. Surgeons often recommend this movement after spinal procedures because it rebuilds the muscular support cables that hold the spine in better alignment and help slow degenerative changes. And now, we're ready for the most important exercise of all, the one surgeons are prescribing more than any other. Number 1, sit-to-stand squats. If you pick just one exercise to keep for life, make it this one. The sit-to-stand isn't merely a workout. It's a real-world marker of how well your body is aging. Researchers have shown that how well you can rise from a seated position can predict long-term health outcomes, including mortality risk. One well-known study in the European Journal of Preventive Cardiology followed more than 2,000 adults over 51 for about 6 years. People who couldn't get up from the floor from a seated position without using their hands were 5 to 6 times more likely to die during the study window. That single ability reflects total body function. And it makes sense because sit-to-stand squats recruit nearly everything below your waist at once. Your quadriceps straighten the knees, your glutes drive the hips forward, calves steady the ankles, your core balances you, and your back keeps posture stacked. Few movements train so many systems together. Even better, it's the exact pattern you repeat all day. Getting out of bed, rising from a chair, stepping out of a car, standing up after using the bathroom. When you train it, you're not building gym strength. You're building strength that instantly shows up in everyday life. The 2023 research referenced earlier found that adults over 65 who practiced sit-to-stands 3 times a week improved bone density by 19% in the hips and femurs. That's striking because bone density usually trends downward with age. The repeated load of standing sends a signal to bone to lay down new tissue, which can lower fracture risk if a fall ever happens. For that reason, many orthopedic surgeons now treat this as preventive medicine. Strong legs and denser bones also mean better outcomes if joint replacement is ever needed. And some surgeons even require patients to demonstrate a basic sit-to-stand capacity before scheduling elective procedures. To do it for maximum benefit, begin seated on a sturdy chair. Place your feet flat and slightly wider than hip width. Cross your arms over your chest so you don't push off with your hands. Lean forward a little to bring your weight over your feet. Then stand by, driving through your heels until hips and knees are fully straight. Hold 1 second at the top. Now, the important part, lower back down slowly over 4 seconds. Lightly touch the seat, but don't collapse or fully relax. Start the next rep right away. That controlled descent is the strength builder. If you drop into the chair, you give up a big portion of the benefit. Start with 10 reps if you're new, then build toward 3 sets of 15. When that feels manageable, add light resistance by holding something against your chest, like a gallon jug of water. You can also make it harder without extra weight by extending the lowering phase to 6 or even 8 seconds. Do sit and stand every other day so your muscles can recover. In about 4 weeks, you'll likely feel daily life get easier. Stairs won't leave you breathless. Low couches won't feel like traps. And you'll move with a level of confidence you may not have felt in a long time. In the end, these 5 movements are exactly what orthopedic surgeons wish every adult over 60 would practice consistently. Yes, walking still matters. Heart and circulation health are important. But if your goal is to stay independent, reduce fall risk, protect bone density, and keep real usable strength, you need more than steps. You need resistance-focused training. The evidence is clear, and the medical world is aligned in that direction. Chair-based exercises that load your muscles against resistance deliver better improvements in functional strength than walking by itself. And the best part is, you don't need a gym fancy machines or an athletic background. A solid chair, maybe a resistance band, and about 15 minutes 3 times a week is enough to start changing your trajectory. That small weekly commitment can translate into more years of active self-sufficient living. Begin today with exercise number 5. Spend the next week getting comfortable with it, then add number 4. Move through the list at a pace that feels right for you. By the time you reach sit-to-stand squats, your body will be prepared to handle it safely and effectively. Your future self will be grateful for the strength you build now. Now, we want to hear from you. Which of these 5 chair exercises are you most eager to try first? And have you ever been told that walking is the only workout you need after 60? Share your thoughts and experiences in the comments. We truly enjoy reading them. Thanks for watching.